Hi, this is Inez with Teach Me ABA. Today we're going to be talking about crisis management. Have you ever wondered to yourself, what do we do as behavior analysts when a crisis arises? Well, we go into crisis management. What are the benefits about having a secure plan for crisis management? Well, the most important thing is safety. This promotes safety for both the individual that is in crisis and the person that's managing the crisis. It promotes adaptability and resilience. Well, again, for both the person that's in crisis and the person that's managing the crisis. It also creates stronger bonds between the person who is in crisis and the person who is managing the crisis. So how do we know when to talk about crisis with a family? We need the right time and setting. We wouldn't talk to a family about crisis when the crisis is happening. We'd wait until the crisis is done, and then we could talk to them about what just happened and how to better support the person that's in crisis. We need to talk about understanding and perspective. We need to ensure that we talk about understanding and perspective. Everyone that we come into contact is very different. We all come from different cultural backgrounds, and it is very important to take those cultural differences into account. Some cultures, it's okay for someone to act in a certain maladaptive way. In other cultures, they may not be. So it is very important for us to take that into perspective. We have to have effective communication. We need to slow down the way that we talk. We need to make sure that we give them all the information possible, and that we take into account that this is a human being that we're treating. So, how do we talk about crisis for a family? First, we need to address misconceptions. A lot of people think when a crisis happens that this person may be bad or that it is not fixable. The reality is everything is fixable. Using the right crisis management plan can really help a person in crisis become more stable, and in doing so, creating a better learning environment. An important part about talking to families about crisis is sharing those real life successes. Nobody wants to hear about how something failed. People want to know how we did this well. People want to know how it works well. So by sharing this information with the parents, it is more likely that they're going to give us the buy-in into the crisis management. We need to lead by example. Of course, no one wants to just see a floating head. People want to see actual people getting into these procedures in order to gain that trust. We always want to assess the risk and vulnerabilities. There are some risks to crisis management, but if you have the right crisis management system, those risks are reduced, and that's what we want. Risk reduction in order for a better outcome. So again, when talking about crisis management, address misconceptions, share real life successes, lead by example, and assess risk and vulnerabilities. We talked about when we should talk about crisis. We need to choose the right time and setting. We need to understand the perspective and concerns of the people we're treating, and we need to have effective communication. So all in all, how do we talk about crisis management? We need to address misconceptions. We need to share real life experiences and successes. We need to lead by example, and we need to assess risk and vulnerabilities. So please like, subscribe, comment, share. So if you know anyone that has someone in their life who may be in crisis or needs help with dealing with crisis, share information with them so they could reach out to us and we could help them navigate getting into crisis management. If you have any questions, comment below. And like always, please like, share, subscribe, or reach out to us.